Hey there, I'm Dr. Ruth Roberts, your pet's ally. I hope that you are all having an outstanding day today, and I am very excited to share this information with you about medical cannabis for pets because there's like a zillion products out there, and some of them work and some of them really don't work. And that's been so frustrating because I'll see people spend money on products and they're expecting that they've done the very best thing they can for their pet. And then all of a sudden, nothing happens. They get absolutely no results. And that is so disappointing. So, what I wanted to do today is to explain to you how medical cannabis works, some of the science behind it, some of the pitfalls with cannabis. And what I'm talking about for the most of this talk is CBD or cannabinoid oils or treats or what have you, and why you may have not had such great results, and then things you can do to actually improve the results. So without further ado, I'm going to jump over to the slide deck. And my friends at CBD Dog Health, who I just love them. I did an interview yesterday with Angela. They have done so much to help explain to the public what these products are, what they don't do, and what you can expect for your pet. And I think that's been so important because, frankly, there's so many promises out there. Sometimes they work, sometimes they don't work, and it really gets super frustrating. So let me pop back over to the slides here and we'll just jump into it. So, one of the first things that I want to talk with you about is the endocannabinoid system. And this is how CBD exerts its effects. And without this system present in our bodies and in the bodies of our pets, then this whole thing wouldn't work. And it really is shocking how much this system may actually be the master system for many different types of body systems. So pretty much every animal, including vertebrates and invertebrates, have been found to have endocannabinoid systems. And this consists of endogenous ligands, so the things that kind of get the work done, the membrane receptors, and then also deactivating enzymes. And slide is super busy, but what I want you to understand is, what does this system do? It is responsible for maintaining homeostasis. And this is the most important concept you can pull off of this slide. So homeostasis is what helps keep your body in balance. But overall, this is a regulatory system that works in complement with the immune system and the neurological system and the other organ systems to help respond to their directions. So again, the main goal here is homeostasis, keeping everything in balance. So it's a beautiful place. It's a beautiful thing. And then we've got two different types of receptors, CB1 receptors and CB2 receptors. And both are found all over the body, but these are where they predominate. So CB1's in the brain, the lungs, the muscles, all of that. You can read through these slides as quick as I can read them to you. And then there are some specific locations where both receptors are found, and that's predominantly in the immune system, in the bone marrow, also part of the immune system, and the pancreas and the brainstem, so the thing that keeps us doing our daily deal. Now, in general, CB1 receptors will affect circadian rhythm, and CB2 receptors impact the immune system. But the other thing is, that's sort of a general rule. Nothing is hard and fast. So there's nothing hard and fast. So as soon as we make a rule about the system, something else, some new research comes out to change that. So in a study conducted by the Department of Veterinary Medical Sciences in Italy, dogs were found to have a substantial amount of receptors in their endocannabinoid system, especially in the spine. And so here's a slide that sort of shows you this. So here's humans, and the stain, the darker the stain, the more there is receptors for the endocannabinoid system. This helps to explain why dogs can be so much more sensitive to hemp and marijuana products than humans are. And the other thing that was interesting in this study, they showed that CB1 and 2 receptor density increases in the brain. And as we age, we need more input to help our brains know what to do with what's going on in our environment. So this next slide is looking at CB1 receptors, and their basic actions are to mediate inhibitory action of the release of the following neurotransmitters. So dopamine, GABA, glutamine, serotonin, noradrenaline, and acetylcholine. And their main receptors are to help modulate. Now, notice I'm not saying elevate or decrease, modulate, and that's a really important distinction, meaning it keep, again, homeostasis, balance, mood, cognition, analgesia, anti-inflammation, anti-nausea, and psychoactivity. Outside of the central nervous system, they're found in fat, liver, musculoskeletal system, all these places. So this is pretty interesting, the distribution. Now, CB2 receptors are primarily in cells of the immune system. So they're in the T cells, B cells, macrophages, but they're also in the spleen, liver, kidney, and skin. And their main functions are immune modulation, again, that word of achieving balance, anti-inflammatory, and they help to maintain bone density. So for this reason, CBD can have an effect in improving the function of the immune system. As far as homeostasis goes, in cancer, CBD may increase the immune system's ability to surveil and attack cancer cells. In autoimmune disease, the opposite. It may diminish the attack of the immune system on the self. So again, let's keep it all in balance. So endocannabinoids are natural neuromodulators. Again, we're seeking balance. And there's two main ones, the anandamide and 2-AG, the 2-arachidinoglycerol. And they are both synthesized on demand during times of stress. They travel across the synapse in retrograde fashion. And what that means is that this is a feedback mechanism to let the body know that, hey, we're all good here. We can slow down production on this stuff because we've got it all covered. Now, if you look at these two different substances, anandamide binds to CB1, CBD, and a different receptor called TRPV1, and it is the Sanskrit word for bliss. So this is the thing that gets you all chilled out and helps you get through that time of stress so that you're not freaking out and running around like a chicken with your head cut off, and you're able to handle what's going on. And then 2-AG binds both CB1 and CB2 receptors. And there's a boatload of other endocannabinoids available as well. But these are things that these two that I'm mentioning are the very most common. Now, if we look back, as I mentioned, there's all these other receptors and all these other targets of endocannabinoids and phytocannabinoids. And again, we've got this split out, CB1 and CB2, in the brain, in the HPA axis, in the spinal cord and central nervous system. And then the receptors are in various other organs with varying amounts. But all of these things are going to modulate this alphabet soup into helping the body function more normally. So the reason I'm giving you all of this sort of high-tech stuff is that you're going to see these initials more and more frequently. I'm guessing that at this point you already know what GABA is and what dopamine is, because those are two neurotransmitters that are super important for things like Parkinson's disease and depression, things of that nature. So just be cognizant that this alphabet soup is interacting with all of these receptors. Now, the other thing that's really important to remember is that phytocannabinoids are plant-based, and they are exogenous, meaning they're compounds that come from the outside that work on the cannabinoid receptors, our endogenous cannabinoid system. And the two main ones you're going to hear about are THC, and in specific, delta 9 tetrahydrocannabinol and cannabidiol. And these are the two things that are being sold currently. Um, THCA and CBDA are what's present in the plant, but they are not very active in terms of some of these functions. They are decarboxylated into the inactive form of the plant. And what that means is that either they're dried, they're heated, or in some other way treated so that they have activity within the body. The main effects for THC are going to be pain relief, anti-nausea, sleep aid, and an appetite and mood stimulant. And this is more of the desired medical effects. And then with CBD, our main effects are going to be pain relief, anti-inflammatory, anti-anxiety, seizure reduction, for which it's really well known, and also anti-nausea. Now, there are boatloads of other compounds within each plant, and there are over 700 compounds and 114 different phytocannabinoids, and they're subbroken down into terpenes, flavonoids, and there's other things like vitamin B and essential fatty acids present as well. These help balance the effects, both good and bad, across all the compounds. So this is why when we isolate specific types of CBD, maybe we don't get the effects we're looking for. The other thing I want you to be aware of is the anatomy of the cannabis plant. And the reason this is important is that this is where the good stuff is, up in the trichomes. These trichomes produce little bits of resin, and they contain the most of the active parts of the plant, the things that really produce the effects that we're looking for. And additionally, there are male plants, there are female plants. The female flowers are the ones that have the majority of all of these goodies that we want to help ourselves and our pets. The male flowers have some of them, but not a tremendous concentration. So the reason that I'm showing you this is that this is the reason that full spectrum extracts are important, and the part they are extracted from are critical. So if you've got a company that's making CBD from fan leaves and stems, the potency and the bioavailability and the activity of that product is going to be much, much less than a company that uses only the female flowers. So I think that's really important for you to know, because this is what accounts for the variable effect of CBD products for pets, because frankly, a lot of what gets put on the pet market is garbage from the human side that just doesn't work. And that's true whether we're talking about food or supplements or CBD. Unfortunately, the veterinary market just is the dumping ground for stuff that doesn't work as well on the human side. Now, I'm telling you all of this because I want you to know that CBD Dog Health uses only the flower and provides you an essential oil type product versus others that are going to use leaves, trimmings, and essentially the garbage parts of the plants. These are the parts of the plants that are best used to be turned into things like paper, clothing, and rope. Now, CBD or cannabidiol has a ton of effects, but it's very interesting because it does not regularly bind to CB1 and CB2 receptors. So normally we think of this receptor, here's the thing on it, and it is completely covering the receptor and nothing else can get there. And that is indeed the way that many chemicals or hormones or what have you interact with CB1 with their receptors. But in this situation, there's something going on called partial binding, which means that your body can still come in and help. But what's happening is the thing that is doing some of the work, but it's still allowing your endogenous system to do the work as well. And what this means is that we're not shutting off the normal production of the internal normal endogenous system. So as you can see, we've got all these effects. It can be a stimulator for both CB1 and CB2 receptors, and it can also increase the activity of other endocannabinoids, as I just said. So we've got all these good effects that we're seeking. The other thing that's interesting is that it may also dampen but make longer the psychoactive effects of THC. So for this reason, that used to, in the good old days, for anybody that is as old as I am that used to smoke marijuana, you had a much more balanced high. But now much of the THC can be 25, 30% or higher. And so that can create some really big problems for people in terms of the psychoactive issues and getting effects we really don't want. Now, again, CBDA is the most prevalent cannabinoid found in the hemp plant. But when these plants are allowed to dry or they're heated, then CBDA converts naturally to CBD. And so it is an interesting process. There were a lot of people saying, "Gosh, should I use the CBDA only compound?" And I took a lot of research to understand what they were asking. So evidently, CBDA can have better effects as far as being an anti-inflammatory and things of that nature, which is great, except for that it's super hard to keep it in that form outside of the plant. So eventually what happens is that all of that CBDA ends up converting to CBD anyway. So the other thing we wanted to talk about too is THCA. Again, once people are actually juicing cannabis leaves to get THCA though, but you've got to be able to juice the plant fresh and then drink that immediately, because once it's been processed in any way, then it starts to convert to THC or delta 9 THC in specific. THCA does not bind to CB1 receptors, and then a majority of what's grown in the US has more THC in it than any other cannabinoid, hence these super high concentrations in what you might buy at a dispensary. And then delta 9 THC is the one that is psychoactive. CBD is not psychoactive, meaning it's the part that gets you high. It also can have all these other great health benefits in terms of being analgesic, antineoplastic, all of these other things, promoting sleep, GI support, things of that nature. So just be cognizant of that. Any CBD on the market will have less than 0.03% of THC, if I'm saying that correctly. One of the other big things that's present in both CBD and THC type plants of marijuana are terpenes, and these are things that are used normally by plants for protection, signaling, attracting, things of that nature, and they are the primary source of the smell and taste. So there are something like over 200 different terpenes that we're aware of. Again, these are produced in the trichomes of the plants. They are made up of, and this is high-tech stuff, but made up of isoprene units, so 5 carbon, 8 hydrogen units. And again, they're the most diverse class of natural compounds. So some of them that you may have heard of already are limonene, squalene, vitamin A, which interestingly is indeed a terpene, and then natural rubber. So this covers a huge gamut of different types of products that we're familiar with, but we may not have understood their source. Now, in this slide, this sort of looks at some of the main terpenes that we may be familiar with. So myrcene is got this mango or lemongrass. Found in mango and lemongrass. It tends to be a little more earthy and herbal. Pinene, as you might guess, has an aroma like pine. So, literally pine needles and rosemary. And then limonene has got a citrus type aroma. So for those of you that are involved with essential oils, you may be familiar with some of these and some of their potential benefits. They can be the things that create, so like a limonene will use lemon oil as far as an essential oil to help lift you up a little bit. And so this little slide goes through a couple of their benefits and then their potential medical value as well. So pretty interesting stuff. And then in the next slide, we're looking at some of the physiological effects of terpenes. So they, as I mentioned, they can have their own specific effects. So for instance, myrcene is typically higher in the indica strains of marijuana, and likely this is what's producing the sleepiness or sort of deep body relaxation that's associated with them. And they have their own effects as far as helping to absorb and utilize some of the other phytochemicals that are present in medical marijuana plants as well. Now, flavonoids is another huge class, and these are considered to be the things that produce antioxidant, anti-inflammatory, and immune system support. So we've got at least 29 flavonoids that we know of. One of them that is you may be familiar with is quercetin, and this is certainly something I've recommended for a number of years to help provide relief with allergies, but also to support kidney function. Because again, we're going for anti-inflammatory effects of the quercetin to help support the kidney functioning better. And then all of this to say, we've got all of these different phytochemicals that are present, the terpenes, the flavonoids, and the cannabinoids. And these all work together to produce an entourage effect, meaning that the sum of the parts is much greater effect than any of the individual phytochemicals. And for this reason, because we've not seen individual derivatives work really well, like I mentioned earlier, CBDA, it's supposed to be so much better for arthritis. In the patient, it didn't work out that great because, again, it just wasn't stable. And then the other thing is we don't understand what else in that plant it needs to work to its best effect. So I hope that's one of the big take-home lessons here, is to make sure that you're having a full spectrum extract, again, for this reason. So what is it? It is a full spectrum is a product that has a range of other cannabinoids and phytochemicals in addition to CBD. And again, THC is going to be less than 0.3%, terpenes, flavonoids, the whole 9 yards. So that's the kind of full out definition right there for you. And the broad spectrum, again, I've talked about this already. Yeah, quercetin is the bomb. So I've talked about this already, but the broad spectrum offers us, the person, the animal, so much more benefit than an isolated product because, again, we don't understand what the rest of the plant is doing to support the specific action. So quercetin, with the way I use it, is an example of an isolate, but I know that isolate works well. But how much better would it work if we gave a bioflavonoid product? And that's the concept. There's other benefits to doing that. Now, there is a lot of stuff out there about, is it safe, is it not safe? This is one of the very first papers that came out, and this is what made many veterinarians afraid of CBD. But I want you to note the dosing here. For small dogs, 10 milligrams per kilogram is close to the recommended upper dosing levels of CBD for very sick patients. But the dogs they used in the study were about 13 kilograms of weight, so about 26 pounds. So they were receiving somewhere between 130 to 260 milligrams per day. And that is about 3 to 5 times higher than would be used clinically. But that's the point of this type of study. What if we give them way too much for a long time? What happened? And what happened is they did see some elevated alkaline phosphatase, one of the main liver enzymes, in about 36% of the patients. The rest of the blood parameters were normal. There was some mild GI toxicity, and then interestingly, some redness of the ears in a little less than half of the dogs, or a little more than a third of the dogs, I should say, and then nasal and ocular discharge in 1/3 of the dogs. So the other thing I want you to know about this study is that the researchers found that they were looking at a bunch of different products in this study as well, and they found that the actual CBD versus the content stated on the label was very frequently much less than was stated on the label, and in some case only about 3% of what was stated, which is pretty horrifying. But unfortunately, in the supplement industry, that is really common. Now I'm going to whiz through a couple of other studies here that will be useful later on. The single dose, this osteoarthritis study at Cornell, they were looking at using a CBD oil at 2 milligram and 8 milligrams on 4 beagles. And so what they were able to find was that the 2 milligram per kilogram dose of CBD twice daily can help increase comfort and activity in dogs with osteoarthritis. And the whole thing about this is when the standard dosing recommendations that you often hear from veterinarians, and frankly, I said them for a long time too. This is where their recommendations are coming from. We'll say start with 2 milligrams per day and go from there. This next osteoarthritis study was randomized, double-blind, placebo-controlled study. And when your veterinarian says that they are an evidence-based veterinarian, that means that they think they are relying on these types of studies to make recommendations to you. The interesting thing is that less than 11% of EBM or evidence-based medicine recommendations are actually backed by this type of study. So the really cool thing is that they found that the CBD significantly decreased the pain and increased mobility along with the dose. And the researcher said that he openly admits he was surprised at how quickly he saw such large results. He wouldn't have expected to see much of anything in about 30 days. So that was really slick. And then the epilepsy study at Colorado State University. They gave dogs 2.5 milligrams of CBD twice a day for 12 weeks. And what they found is that dogs at this dose had an 89% reduction of seizure activity. And frankly, that is pretty amazing. That's close to the gold standard of things like phenobarbital and potassium bromide and Keppra. So with a much less side effects out there. And then looking at dog cancer. So this is one of the things that's really important to know is that there is a difference between in vitro and in vivo. So in vitro means that it works in the petri dish. In vivo means that it works in life. So this is a really important distinction to make. And this is part of what's really important. And I apologize, I seem to have done something peculiar. There we go, with my notes so I can keep myself on track. So this is in vitro, meaning this is what they saw when they exposed a particular cancer cell growth to CBDA. And when combined with vincristine, which is a very commonly used chemotherapeutic, they saw that there was anti-proliferative effect and also improved cell death, meaning it slowed the cancer cells down from dividing so quickly, and it started to cause these bad boys to actually die off like they should be. So they found that this combination in treatment of cancer with CBD alone and with combination with common chemotherapeutics could have a really big effect going forward in cancer treatment. Now, one of the other big places this can really have a huge effect is in the skin. So again, we know that there are CB1 and CB2 receptors present in the skin, and so this may be a really amazing way to start to help some of our pets with allergic dermatitis, things of that nature. So we get a more normal immune response because essentially that's part of what's gone awry. And the other thing that's really interesting is that there's a potential for assisting pets with Susan, I'm going to go back and hit some of these questions when I go through this so it makes some sense. But this is part of why people are, and certainly CBD Dog Health has developed topical products, because if you have a localized skin problem or a skin tumor or say eosinophilic granuloma, like cats get, this may be a huge help. You don't have to give the pet anything systemically. You can treat the localized area. And then lastly, for Cushing's disease, we can see that these cannabinoid receptors are really important in regulating the neuroendocrine system. And we know that Cushing's disease, these poor pets are generally have what's called a benign pituitary tumor that's just creating way too much adrenocortical stimulating hormone. So what if we could use something that is going to not have side effects for the vast majority of the patients to get the neuroendocrine system to chill out and do things on a more normal basis. So modulate again. So how do these suckers actually produce or help us combat inflammation? So we know that in humans, the endocannabinoid system plays an integral role in signaling that, hey, let's calm this down, or hey, we need to amp up our response to this situation. And we know that an unhealthy endocannabinoid system can lead to excess inflammation. And we know that our immune cells have a ton of different cannabinoid receptors present. Again, mostly CB1 and CB2, but we're just starting to scratch the surface on our knowledge. And they help to they can bind to our immune cells and decrease inflammation by blocking enzymes that would break down the natural endocannabinoids. They would decrease the release of chemical messengers that tell us to amp up the inflammation, and also leading to decreased swelling and inflammation in the tissues by decreasing reactive oxygen species and reactive nitrogen species. Now, there are all these amazing effects out there, but scientists aren't the only one that knows that. And here's where this gets a little weird. Cannabinoids are actually, as antioxidants and neuroprotectants, the patent is owned by the US government, which is really bizarre, but there you go. So the reason I'm mentioning this to you is that there is a trade product called Epidiolex, or Epidiolex with an I or a Y, and the problem is that the owner or the purchaser of the use of the patent is now calling CBD companies, and if they are producing a product that is not full spectrum, their lawyers are calling and shutting them down. So it's like everything. Everybody wants to own the rights, or major corporations want to own the rights to something so that it cannot be used by the general public without the help of a doctor or some other professional. Now, we know that the endocannabinoid system is abundantly expressed in the GI tract. It can have all of these effects as far as decreasing intestinal motility, decreasing gastric acid, altering the GI mucosa, the immune system, the whole 9 yards. It can also improve appetite or suppress it. And again, it depends on what's actually going on. And there are in process over 400 studies looking at all of these products. They're looking at how the CBD and THC will interact with these various organ systems and things of that nature. Now, I'm going to talk a little bit about cannabis toxicity versus intoxication. And this is of two very different things. So we have this weird thing called static ataxia in dogs that consume an excess amount of THC, and it looks pretty awful. Our pal here is really having some problems, but later things wear off. So these are all potentially a problem, but the really fascinating thing is that there is no LD50, meaning there is no lethal dose of, And there's an lethal dose of THC. But again, they have the highest receptors available present in their little brain, so they're going to have a lot of effect from a small idea. Think about this in terms of alcohol consumption. There can be alcohol toxicity, meaning it really can kill you at super high doses, but mostly we just we have intoxication, we go home, we may feel bad the next day, everything is good. With dogs, there really isn't a problem with toxicity. Now, you can see all of these side effects, and as far as sedation, tachycardia and hypotension, I think that's more of an issue the higher the dose goes. Urinary incontinence, either both retaining urine or passing it, things of that nature. But the reason I want to get you a little bit of information about THC is that at a safe dose, right now in veterinary medicine, it's unsafe at any speed, right? Just like the Corvair, and it is still not legal across the nation, but it is coming probably. But this can be extremely helpful for cancer patients and for pets facing hospice type situations. So how would you use it? You can CBD and THC, you can use it sublingually, orally, transdermally, rectally, all sorts of ways. The best way to administer it is probably sublingually because it's, especially in a really highly available carrier like MCT oil, it is super easy to get it into the patient. You can put it in the food and you can also put it on the ear, so dermally, but the absorption rate is much, much slower. So the other thing that's interesting is that dermally you would have to really have a super high dose long term to get it in there. So how do you do it? Shake the bottle first. Lift their lip so you get all the good stuff mixed up in there. Lift the lip, squirt it into the gums, and then give them a reward. Our cat, Pepe, Hayo's been using CBD for quite some time. She's, oh God, okay, just squirt it, and then I get my breakfast or dinner. And Pepe is finally acquiescing to it. He's 12, and he started having some back pain. And so this was a great way to get it going. The thing that's also important is there's a huge dosing range, but the most important thing is to start low and work your way up. And so our friends again at CBD Dog Health, they've got several different products. They've got some dosing ranges based on what we're trying to accomplish. If we're trying to calm down the dog, kind of 9 milligrams seems to be a pretty good place to start. Hayo weighs about 6 pounds. She needs about 9 milligrams twice a day to keep her chilled out, but it's been remarkable. And we're in Mexico, the fireworks are just like part of life. They sound actually more like rocket launchers. She has gone from being absolutely freaked out for hours afterwards to being freaked out for 5 or 10 minutes, and then it's okay. She's figured it out. So again, you want to choose safe products. I'm going to whiz through this because I've been being a little bit. I'm happy to get you more information. And also, if you go to the CBD Dog Health website, they have a whole page of research that they have compiled. So one of the things I'm going to tell you is ask the manufacturer for a certificate of analysis. And what this means is that they have sent their product to a third party to have them test it to show that it does have what they say they have in it. It does not have things they say should not be in there, all the heavy metals, the pesticides, all of that grossness. So this is super important. On the label of every CBD Dog Health product, there is a QR code that you can scan and get the certificate of analysis. Full spectrum certificate of analysis, good manufacturing practices so that you're guaranteed that all of the right stuff is in there and none of the wrong stuff is there. And then also consider the bioavailability of the product. The way it is sized has a huge impact, and also how it is delivered has a huge impact. So MCT oil is one of those beautiful oils that you can absorb almost immediately from your mucous membranes. Hemp seed oil is going to help reduce inflammation, protect your brain, all those good things. And again, it's part of where the all of the good things we're looking for, the CBD, the terpenes, et cetera, are right there in the product itself. So again, look at the label. The CBD labeling is extremely confusing for some reason because this is what the government says the companies have to do. What many companies do not do is tell you this: one dropper is 1 ml, and that's a serving, and then there's 60 servings, and this is how much is in each serving. So it is super important and super confusing because I've seen some of these products that are 3 milligrams per ml versus 20 milligrams per ml, and you really need to know what you're doing to be able to dose your pet appropriately. There are tons of success stories out there. We're having some amazing ones of our own. This is one of the sort of test cases, if you will, that really got Angela and the CBD dog health folks rolling. And so here's this amazing series of photographs looking at this gnarly tumor. And we end up with a much reduced situation. There's a little scab where it's all fallen off, and life is beautiful for Miss Daisy. There's tons and tons of wonderful reviews. And again, you can check those out on our site. You can check that out on CBD Dog Health. And again, papillomas, things of that nature, that's where these topical products can be super helpful. And then what I'm going to do is just jump into these products so you get a baseline understanding of the goal here. So the Calm products are for dogs, cats, and horses, are combined with lavender essential oil to help reduce separation, anxiety, stress, all of the things that we want to help calm our pets down for. So you can use it on a day-to-day basis. You can use it on an as-needed basis. If it's the 4th of July, that's a day you're going to want to dose up. Ease is designed with frankincense and boswellia, and it is designed to help reduce, frankincense and turmeric. Frankincense is boswellia. So it is designed to reduce inflammation and pain. The dosing here is going to be roughly the same as the Calm, about 9 milligrams per day. And notice I'm not saying per pound or per dog or per cat. What our goal is to give enough of the CBD to have the desired effect by giving more than enough for the CB receptors to do what they're supposed to do. And again, if 9 milligrams is maybe the goal dose, start with 2 milligrams. See how your pet responds to it. Again, Hyo takes 9 milligrams twice a day of the Calm product to help her chill out. If I take a milligram of CBD, I am out for 36 hours. So each individual is going to respond differently. Now, Heal is the product that they use for really serious diseases, autoimmune disease, cancer, seizures. And again, the goal dose here may be 35 to 50 milligrams today. So again, start low, work your way up. Take care, take caution. Watch what your pet is doing and give it 2 to 3 days before you do increases in dosing so that you have time to see what's what. Salves are available for dry skin, itchy, lumps and bumps, all of those good things. And then there's also for dogs that are just not buying into taking a squirt in the mouth. They've got these marvelous salmon-based treats, so they're really awesome. So that's what I have for you today. So for more information, you are certainly welcome to contact us, contact the good folks at CBD Dog Health. And we've got, because things are weird out there as far as what the government says we can do and what the government says we can't do, we have a situation where I can show you products on my website, which I'd encourage you to go take a look at, but I can't sell them to you because there's only certain credit card takers and things of that nature that will let us sell them directly and not keep the money. So for instance, PayPal is notorious for not allowing CBD companies to collect payment through their system, and it's understandable because the Banking Act is such that they are potentially at risk of having all of their funds seized because these products are not legal across the country. But there are folks that have got it worked out the way things are going. Hopefully we will start to see those changes occur. But for now, if you head over to the website, you'll see these products over on my site. And I'm sorry, I'm got slightly lost in the text. So check it out here. When you click on them to go purchase, though, you're going to get sent over to CBD Dog Health. But I think that this is so important, and I have seen so much improvement in our patients on these that it's made it important to me to make sure you have easy access to these products. And again, dogs, horses, cats, they've got products for everybody, and then several topically applied products too. So that's what I've got for you today. Really awesome questions out there. And Susan, I don't know Elevet CBD oil. Again, there's so many out there. When I find something that works and that I feel confident in, I tend to keep using that product and supporting that company. The other thing is that these guys are supporting research, and they're making available and easy to access the research. So that's what I've got for you today. I hope that you all have a marvelous day. We'll start doing more lives. Angela and I did a really fun interview yesterday. I hope to start doing more of those with her so that we can get you a multifaceted approach to some of the big problems out there. Take good care. I'm Dr. Ruth Roberts, your pet's ally.